Prostate Cancer by Jessica Olson and Brittany Rath. So what is the prostate? The prostate is a gland that resides in men and is approximately the size of a walnut. It is located between the bladder and the penis and has the urethra running through the center of the prostate that helps relieve the patient of urine. So what does the prostate do? The prostate secretes fluid that protects sperm and keeps them nourished. During intercourse, when a man ejaculates, the prostate squeezes this protective fluid into the urethra and is expelled with the sperm and semen.
Cancer begins with a mutation in normal prostate glandular cells, usually beginning with peripheral basal cells. Prostate cancer is most common in the peripheral zone, which is primarily that portion of the prostate that can be felt during digital rectal exam. Prostate cancer is an adenocarcinoma, as it develops primarily from the glandular part of the organ and shows typical glandular patterns on microscopic examination. The cancer cells grow and begin to multiply, initially spreading to the immediately surrounding prostate tissue, forming a tumor. Such a tumor may grow outside of the prostate or may remain localized with the prostate for decades. Prostate cancer commonly metastasizes to the bones and lymph nodes. Metastases to the bone are thought to be at least partially a result of the prostatic venous plexus draining into the vertebral veins. Symptoms of prostate cancer include trouble urinating, decreased force in the stream of urine, blood in the urine, blood in the semen, bone pain, losing weight without trying, and erectile dysfunction. Factors that increase your risk of prostate cancer include older age. Your risk of prostate cancer increases as you age, and it is most common after age 50. For reasons not yet determined, people of color have a greater risk of prostate cancer. Prostate cancer is also more likely to be aggressive or advanced. Family history. If a blood relative, such as a parent, sibling, or child, has been diagnosed with prostate cancer, you may be at a higher risk. Also, if you have a family history of genes that increase the risk of breast cancer or a very strong family history of breast cancer, your risk of prostate cancer may be higher. Obesity. People who are obese may have a higher risk of prostate cancer compared with people considered to be a healthy weight, though studies have mixed signals. In obese people, the cancer is more likely to be more aggressive and more likely to return after initial treatment.
There are a few diagnoses that can be done to determine if a patient has prostate cancer, starting with the digital rectal exam, or DRE. This is where a doctor will lubricate a finger and insert into the patient's rectum and to examine the prostate. During this examination, the doctor will be feeling for any abnormalities in the texture, shape, or size of the gland. Blood test. Prostate-specific antigen, or PSA. This is a blood sample that is drawn and is tested for presence of PSA in the blood. Although it is normal to have a small amount present, if there's a higher amount found, it may indicate a prostate infection, inflammation, or cancer. Ultrasound. This ultrasound is transrectal, meaning a small probe is inserted into the patient's rectum. By doing this, the doctor is able to get a clearer picture of the prostate gland. MRI. This is done to get a clearer picture of the prostate, so doctors may plan a procedure to remove prostate tissue samples. Biopsy. This is done to collect samples from the prostate to test for cancer cells. Treatment for prostate cancer. In stage 1, the growth of cancer can be very slow and may never see symptoms. So they will start with active surveillance, knowing there may be treatment needed later on. Stage 2 is continuing with active surveillance, where the patient will also start radiation therapy, where there is two choices of external beam or brachytherapy. External beam is high-energy X-ray beam that is directed at the tumor from outside the body. Brachytherapy is internal radiation, where it is in direct contact with the tumor. Along with radiation, the patient will also have hormone therapy, which helps decreases the male hormones. Stage 3, the cancer can spread outside the prostate and will need external beam therapy combined with hormone therapy and a possible surgery of a radical prostatectomy, which is the removal of the prostate gland. Stage 4 means the cancer has spread to nearby sites of either the bladder, rectum, or lymph nodes, where the treatment is a combination of active observation, hormone therapy, radiation, chemotherapy, immunotherapy, surgery, or looking into clinical trials. As per the Alberta Cancer Foundation, 1 in 6 Albertan men will be diagnosed with prostate cancer in their lifetime, and more than 2,700 men will be diagnosed with prostate cancer in Alberta this year alone. The foundation is in the process of developing a different blood test than a PSA that tests for the biomarkers that Dr. John Lewis has discovered. This biomarker will help accurately predict which patients with prostate cancer will have their cancer reoccur or spread even further. This blood test will be able to screen for this antibody and could become common practice in the next 3 to 4 years. This discovery could potentially one day help doctors give better treatment to the men who will benefit from this discovery. The University of Australia is taking the already prescribed prostate cancer drug abiraterone acetate and completing preclinical trials that will help improve the formulation and make the drug more effective by almost 40%.